Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone, and welcome to today's professional. Today, we're talking about Lima, New Bremen, and Spencerville Dental Associates. And with us in the studio, I introduce Dr. Stephen Wojdyla. I got that right?
You
Good.
got that right. Thanks,
all right.
George. Good
I
to see you
understand
again.
we want to talk a little bit about root canals, and eventually we'll get into implants and everything.
Yes. Yes.
What is the goal of a root canal?
A root canal is something that has kind of a negative stigmatization to it. When we think about a root canal, we think of a very long, painful procedure that's done. It just simply isn't that way anymore. When we do a root canal, it's like doing a deep filling inside a tooth. So people understand the concept of getting a filling done on the top of their tooth. What a root canal does is fill the actual root deep inside the tooth. And it maintains the entire root and crown of the tooth and brings the tooth fully back into function.
Are there any other treatments involved with a root canal?
Usually when we do a root canal, you'll need to have a crown placed on the tooth or a cap placed on the tooth. The tooth becomes very brittle after a root canal is done. So if you don't have a crown on there, the tooth can split apart. Now we're in a situation where we have to remove the tooth. So usually after a root canal is done, we usually have to place a crown on the tooth. That protects the tooth from further damage.
How long does it take usually for something like that?
It usually takes about 2 hours, depending on where the tooth is located in the mouth. Some teeth have multiple canal structures, so it takes a little bit longer, but it goes much faster than it used to.
It's not long at all then.
It's not very long.
Okay. Are there some alternatives?
Alternatives?
Yeah.
Some of the alternatives is to consider having the tooth removed and placing an implant or placing a bridge.
Okay. We can get into that here in the coming weeks.
Yes, we can.
When we talk about the implants and so forth. But that's good information. People need to know when they hear a root canal, they sort of get, ooh, you know.
Right, right. The way it is these days, it's not as bad as it used to be, so it's nothing to fear.
Well, good. That's good. That's good to hear. You hear it from the dentist, and he says, "Nothing to fear. It's okay. Trust me." Thank you very much, Doctor.
Great, thanks,
we'll be talking in the weeks to come. Okay. That's our first report today for Lima Dental Associates, along with Lima and New Bremen and Spencerville.